For the past 4 weeks, Dr. Lily Hughes has joined us to talk about hearing myths, what's true, what's false. Today she's back with her 5th segment of 6.
Hi, my name is Dr. Lily Hughes, and I'm an audiologist at the Ear, Nose, and Throat and Audiology Clinic here at Rutland Regional Medical Center. I've done a bunch of different segments on hearing and hearing loss, and today I want to talk about the treatment of hearing loss. So I'm going to go back to my diagram and talk about the different parts of the ear, because hearing loss can occur in different parts, including the outer, the middle, and the inner ear. When someone has an identified hearing loss that's being caused in the outer ear, sometimes it's as simple as earwax. Audiologists work very closely with ENT physicians because if that's the case, we can have that removed for you. Audiologists also remove wax themselves in the state of Vermont. When we move to the middle ear, hearing loss can sometimes be caused by middle ear fluid or effusion, an ear infection. You can have a hole in the eardrum. There can also be difficulty with pressure changes. So when you go up a mountain and your ear doesn't pop, for example, all of that is also typically medically treatable. So we often will have you see an ENT physician. They might come up with a treatment plan along with us to retest and kind of follow that as things improve, hopefully. Sometimes that area can lead to some permanent types of hearing loss, but again, working closely with the physician is very important, as also with an audiologist. So the inner ear, this is where audiologists specifically come into play. The inner ear leads to sensory neural hearing loss. We can pinpoint that during a hearing test. Of course, after getting medical clearance from a physician, which is very highly recommended by the FDA, we can start talking about hearing aids. Now, hearing aids are a tricky subject. A lot of people are like, oh no, it's not for me, it's not thing I'm interested in, they're very expensive, they're very confusing, why would a magazine have a $200 level hearing aid when you're selling them for about $1,000 a piece? There's a lot that goes into hearing aids, there's a lot that's changed in relation to hearing aids, and a lot of people actually are candidates for them, even though they don't know. So in the next segment, I'm going to go over how to be an educated consumer. There's a lot of information on hearing aids out there. It's very confusing. It's very driven and biased to certain companies, such as Miracle Ear, Bell Tone. A lot of health insurances also are trying to sell them online. So you got to be very careful. And I'll give you a lot of information so that you can feel prepared to go into the office, knowing what to expect and knowing what to look for.